Welcome to your weekly dose, a 3-minute or less recap of some of the health-related headlines that caught my attention this week. Okay, so I want to acknowledge that there have been a lot of stories speculating about what the Trump administration will do in regards to healthcare. I did a little rundown on this last week, so until he takes office, I'm going to bring your attention to other health-related stories. In our first story, a healthcare worker who illegally accessed the health records of Supreme Court Justice Ruth Bader Ginsburg before she died was sentenced to 2 years in prison. He was also charged with publishing that information online in forums on 4chan, but the jury acquitted him on that count. Next up, the FDA proposed ending use of oral phenylephrine as an over-the-counter nasal decongestant after an extensive review on new data on the medication. The FDA concluded that the current scientific data did not support the use of oral phenylephrine as an effective nasal decongestant. This is a proposed order based on effectiveness concerns and not safety concerns, and will not affect what products can be marketed at this time. In 2025, Medicare Part D drug coverage will have some changes. There will be an annual $2,000 out-of-pocket cap, which will end the coverage donut hole, and a payment plan will allow Medicare enrollees to pay for medications in monthly installments. In our research rundown this week, for the first time, a robot has been trained by watching videos of seasoned surgeons to execute the same surgical procedures as skillfully as the human doctors. The team at Johns Hopkins, including Stanford University researchers, used imitation learning to train the Da Vinci surgical system robot to perform 3 fundamental tasks required in surgical procedures. Before this advancement, programming a robot to perform even a simple aspect of a surgery required hand coding every step. The team is now using imitation learning to train a robot to perform not just small surgical tasks, but a full surgery. Thank you for joining me for your weekly dose. If you made it this far, clearly you are interested in health news. So why not follow for more? See you next week.